We are recording. We are recording, and so we want to make sure everyone is aware of that. Hi, and welcome to our special webinar. We really appreciate Dr. Catherine Lefevre and Professor John Stone for joining us. Dr. Catherine Lefevre is from the US. She practices in Chicago, and Professor John Stone is from Edinburgh, Scotland, and we wanted to make sure that we had both covered, though we do have members from all over the world, and so I think our topic definitely will appeal to many. First off, is there anything specific? We're talking about the coronavirus and how it is impacting functional neurological disorder. Thank you both for joining us today.
Sure, my pleasure. Hi, Bridget.
Hello. I think we had a few, we're going to take questions towards the end, but we also had some slides that we talked about starting with. And so if you give me just a second, I will share my screen and we can take a look at some of those. Dr. Lefevre, if you'd like to explain.
Sure, I was going to say, maybe I can just say a few words to get us all on the same page. I know it's hard to avoid coronavirus or COVID-19 these days. It's all over the news, obviously. That's why we're here. And thanks, Bridget, for putting this together on very short notice. So, yeah, as you said, I'm associate professor of neurology at Northwestern University, and we have very rapidly seen the impact of COVID-19 just really in the past week here in the Midwest area here in the US, and have very rapidly been able to move a lot of our practice to telemedicine. So I've been connecting this week with a lot of patients by phone or video, which is actually really a nice thing to do. And of course, COVID-19 is on everyone's mind. So I just wanted to very, very quickly review a few slides that were provided by the CDC. And this is information from China. So as you all know, this current COVID-19 pandemic started with infections in China in December, and then quickly spread since the beginning of the year. And so lots of people are obviously concerned. What are really the symptoms? Should I be concerned? And I also wanted to preface that the information we're giving here is really very generic and for obviously up-to-date information for your specific country and area where you live. You should rely here in the US on CDC information or other official information. But in general, the most common symptom of COVID-19 was fever, as well as cough, myalgias, which is really kind of muscle aches, and headache, as well as some diarrhea. And then I think on the next slide, we can see sort of the age groups that were affected. And I think many people have heard that children seem to be less affected, however, are often asymptomatic carriers, so can spread the infection to other people and contribute to the spread of the infection. But in terms of people who were tested positive, again here in China, through February 11 of this year, most patients were in the middle age groups. And then what the yellow line shows is that those patients who unfortunately died from the infection were predominantly older. So especially people over 60 here in the US are said to be specifically at high risk, and then that risk kind of goes up with each decade. And so the next slide will show a bit again, no, actually one back, one before that, will show a bit the distribution in terms of mild, severe, and critical illness. And again, as many of you probably already know, most infections are really thought to be very mild, and people do not need to go to the hospital or doctor, and most patients can really stay at home and get better. But if you do have a more severe infection, especially with very high fever or problems with breathing, in both cases, hospitalization is needed, and those were sort of a 13% here, and then about 5% needed ICU care. What can we all do? So the next slide is also CDC recommendation. Again, this is I'm not telling you anything new here, but just to summarize, so we hear it over and over again. We should all wash our hands. The 20-second rule: wash our hands with soap and water. Avoiding close contacts with people who are sick, and if you're sick, staying home and not getting in contact with other people. Avoiding touching our eyes, nose, and mouth. So that's sort of the idea of not spreading the virus from the surface to enter the body, and again, the hand washing. So those are the nothing specific for FND. It's just really applying to everyone. And then the other intervention that's currently specifically stressed in the U.S., because here in the U.S. we're still in a period where some of the infection has spread in the community, but depending on your region, and in many cities, there are not that many cases. So the idea is if many of us can avoid being in crowds, staying at home as much as possible, that the spread of the infection is slowed down. And the main purpose of this is really to prevent everyone going to the hospital at the same time. So the same here was kind of run to the stores, everyone panicking and buying groceries and toilet paper. So there's currently a significant toilet paper shortage. So imagine this happens with the hospital, so everyone going to the hospital at the same time, and the medical system is overwhelmed. So that's the main background for the whole social distancing rule. So with that being said, I think we can switch over to talking a bit more about FND related questions, and we were specifically going to focus on those 4 questions. So are people with FND at higher risk for COVID-19? Sorry, that was a typo. What measures can everyone take? How are we going to deal with all this social distancing and social isolation? And what support do we have available? So I'll hand it over to John to get started, maybe saying a few words from the UK perspective.
Sure, thanks very much, Catherine. And yeah, hello everyone. I guess that first question, is there any higher risk of COVID-19 from just having FND? I think I can see why this causes a lot of worry for people, because the news is saying, are you in a high risk group? And they're talking about people with chronic medical, do you have a chronic medical condition? Well, FND is a chronic medical condition for a lot of patients. So you might think, well, is that me? But my experience, and also having carried out a lot of the long-term follow-up studies of this condition, is that I don't think FND itself represents any increased risk of catching catching COVID-19.
Sorry for misleading everyone.
Of catching coronavirus, or to be really blunt about it, I don't think having FND itself alone increases the risk of death. So that's a really important, I was very keen to get that message across quite strongly tonight, that this is an illness that's worrying everyone. It worries me, but I don't think having FND should be worried about that you're in a higher risk of death because you've got FND. To give you some examples, we did a study in Edinburgh where we took just over 100 people with FND that caused paralysis or weakness, and we followed them up over 14 years recently, and we didn't find a single death that was related to the limb weakness. I mean, some people did die, they got cancer, some of them had heart attacks. There may be things to do with people with FND find it harder to exercise or maintain fitness. That might have been relevant, but we didn't find any increased risk of pneumonia over 14 years in 100 people. or certainly death by pneumonia. We don't see clinically, as a neurologist, I often see patients with conditions like multiple sclerosis or motor neuron disease, which is ALS in the US. You see those patients coming into hospital because they've got a chest infection. Those definitely can be chronic medical conditions that make people more likely to get pneumonia. But I don't see the same thing with people with FND, and I think that's your experience too, Catherine. Is that right?
I would agree. So yeah, John, as you said, yes, FND is a medical condition, but most of the medical conditions that have been found to have a higher risk for COVID-19 are conditions that affect heart or lungs. So, for example, COPD, other lung conditions. And again, other conditions related with older age. Again, that being said, I mean, really everyone should take COVID-19 very seriously. And I think we are, all potentially at risk. But I agree that there's nothing for FND specifically that would put you in that higher risk category.
I think the only thing, this is something we've discussed amongst colleagues who work in this area. I think the only situation where you might say that FND puts you at slightly higher risk would be if your FND is so bad that you are almost totally, that you are immobile, for long periods. So there probably is a small increased risk in that very small group of people. But we're not, we're not talking about people who are in a wheelchair. We're talking about people who are really not moving at all, which represents a very tiny percentage of people with FND, although I know that does happen and there are people watching who are in that category. But I think for everybody else, I don't think FND alone, so patients have been asking me, should I self-isolate now because I've got FND? And I think the answer is no, you don't need to do that. You just need to do whatever your country is telling you to do, the same as everyone else, I would say.
Thank you both for going through everything and kind of the great advice so far. We are getting in a couple questions, and I think a really good question that someone posed is that she works she's as a nurse, and she's been off work because of her FND, but she is supposed to be going back to work. Now she's wondering if something like this would be a good idea at this time, because while she's not susceptible to the virus any more than anybody else, the added stress of being in that environment, obviously our healthcare workers yourselves, I'm sure you've seen, it's a very stressful environment, I'm sure, for the medical community. What would be your suggestion or your advice?
So I think this is a really helpful question, because we've talked there about what's the absolute risk of catching pneumonia or dying from pneumonia, which I think is the same. But I think there's a different question, which is, if people with FND do get COVID-19, are they going to respond to it in the same way as the general population? And I think we don't know that really, but I think my experience would be that if you have FND and you're already feeling rubbish and ill and have got fatigue or got pain, that having pneumonia on top of that is likely to be a much worse experience for you, and your recovery may be longer than it would be normally. Not because you're more seriously unwell in terms of risk of death, but because it's just you're already ill and then you're getting an infection on top of that. So I think it'd be reasonable to say that to an employer, that you do have a chronic health condition, and you are worried that if you got COVID-19 that would set you back. And I think it's quite plausible that having a chest infection would increase your risk of relapse of FND. So that is, we don't know that for sure, and it certainly wouldn't be everybody. I see people with FND coping fine with infections as well, but that is the reality of this condition, is that people are often much more sensitive to infections. They experience them more severely, and it often feels like they are more that their immune system must be wrong because they're getting more infections. I think the jury's out on whether they actually get more infections, but they certainly experience them worse and have worse symptoms.
And I think I would agree with that. And I think it's a bit related to, I saw another question pop up that said, can COVID-19 exacerbate FND symptoms? So even in this period, of sort of worrying and being potentially anxious about getting the infection and what would that mean for your personal health, but also for your family, for potentially financial implications. So there's many layers to this. And as we all know, in certain stressful situations, anxiety can certainly exacerbate FND symptoms. So I think it is obviously individually going to be different, but I think it's reasonable that for some patients the symptoms might worsen temporarily, and to essentially address this with your healthcare provider team and come up with a plan that you can do at home to deal with that situation.
I think kind of segueing to the mental health, I know that there's some patients that do find a strong connection with mental health exacerbating their symptoms, and some that do not. However, in this situation, is it possible that those that haven't typically seen that connection to possibly now start to see more of a connection with the stress?
I think it's a tricky one because, in fact, I was speaking to someone today and who'd had a relapse just in the last week, and I was saying, can you think of any reason why this might have happened? And we talked about was it the COVID-19, and she felt it wasn't actually. So there's a risk that we kind of make assumptions about that. It's actually normal to be feeling stressed and worried about this. I think it's quite important to say that it's a worrying thing. So, and a bit of worry is normal. Worry is only a problem when you can't control it or you can't move on from it. And we're all being inundated with anxious messages all the time, so it's not easy for people. Yeah, so I think I'm sure there will be people out there who notice that the worry about this, and the fact that also we're being told, people are talking about symptoms all the time and being ill. This isn't great for people with FND, because they've got a disorder where the brain and nervous system is abnormally attuned to that, and part of the treatment is trying to help people defocus from that. So every time you're switching on a telly, it's not helpful,
That's true, and it's all one of the advice I'm giving to people currently. Yes, we all need to be informed to some extent, but try to not be on the television 24/7 and social media 24/7, because ultimately there's a balance between information and information that kind of puts you into paralysis, literally sitting on the TV and not moving and just hearing updates all day. And I think I would absolutely agree with what John was saying. Not everyone will react the same. And as a matter of fact, I was able to see a patient yesterday who had just completed multidisciplinary rehabilitation and physical therapy and psychotherapy. And when I had last seen her 3 months ago, she was in a wheelchair, and I saw her with telemedicine, which again was very great. She didn't have to come in. I could see her in her natural, home environment. So it was a kind of a new experience for me, actually. And she was doing perfectly fine. She had completely recovered, and again was saying, the COVID-19, it's not great, but had been able to chart her own progress and get better. So I think we all have to differentiate our personal situation, our personal life, and sort of this like you said, it's not abnormal to feel anxious and worried about some of these aspects, of course.
Great. We have another really good question that came up, that while FND may not make you more inclined to get the coronavirus, however, the question is, can the medication that some patients are on, such as pregabalin, that maybe weaken the risk of coming through the COVID-19. Is there any medications that you can think of that are, I mean, tend to be prescribed to FND patients that would make them more susceptible to the illness?
Yeah, I mean, it's a good question. Specifically pregabalin or other painkillers, I would say that there's no, I don't think there's any evidence that people get more infections on those medications. When you're up to very high doses of opiates, perhaps like morphine and also diazepam, if that's making you very drowsy, that probably isn't great for your heart and lungs, to be honest. But please don't change your medications or suddenly stop things. These are not great drugs for FND anyway, in most cases, and it might be a good time at some point to slowly reduce them, but with obviously consulting your doctor. So, but this leads on to another really important point, which is that although FND itself is not a risk factor, I don't think, for pneumonia or death, of course, if you may have, many people with FND have other medical conditions. They have other medical conditions at a much higher rate than the general population, because we know other medical conditions are one of the things that cause FND. So if there will be some people out there who have FND who are taking steroids, for example, because they have asthma or some other autoimmune condition. So drugs that suppress the immune system are a problem. They put you into that higher risk category where you have to be much more careful. And if you have other cardiac or lung diseases, then that puts you into a higher risk category, and you may need to then take the advice that your government's giving you about whether to self-isolate and for how long.
Thank you. You know, we have another really good question it's kind of a difficult one. They ask, are people with FND likely to be treated less seriously by hospitals, et cetera, when reporting worsening symptoms because of the stigma and the fact that it's seen how some people view, medical professionals view the illness. If a patient is feeling like they're being maybe marginalized because of their diagnosis, but yet have some of these symptoms, do you have any recommendations that you could suggest?
So I wouldn't feel that would necessarily be the case. So again, we're talking about high fevers, cough, with more severe infections, coughing up of blood, things like that. So those are all fairly significant objective findings, that physicians would take serious. But I think, again, at least here in the US, the advice is really, if you do feel ill, if you do feel any symptoms, do not go to the ER. Call your primary care physician or call the ER first. So very, very important. We really want to avoid that ERs get overwhelmed, get overloaded, and also that you actually put yourself at either risk of, if you don't have COVID-19, to actually getting infected, or if you have it, infecting others. So the advice here in the US is to call first. And ideally, if it's during business hours, call your primary doctor who can guide you. And again, having a thermometer at home is a good idea, so you can actually measure your temperature and give them, objective signs. And then if the question was more, are we not taken seriously if our FND symptoms, worsen? I think, again, the best advice would be to talk to a healthcare professional who already knows you and can hopefully put things, can kind of, again, guide people. Is this something, they should check out for or not? And we have seen incredibly change in the rules to practicing telemedicine since literally the past 2 weeks. So March 6th was a lot of these rules were loosened. So as of now, in the US, many physicians haven't been able to routinely practice telemedicine and be reimbursed for it, or significantly less. But now they can actually connect with patients by phone or video, and it doesn't even have to be a very HIPAA secure connection because of this COVID crisis. We are actually allowed now as physicians, basically as sort of an emergency, to connect with people, even with things like FaceTime, Skype, WhatsApp. So it's pretty unprecedented, and all physicians might not be yet aware of this because we're all trying to catch up. So yesterday, so my office has a secure web connection, but with those patients who were not able to do video camera, have computer connection in their home, I actually did a phone call. Again, we obviously have always done this, so sometimes check in by phone with patients, but this was really an official visit. So again, you might really want to check in with your providers if you have any upcoming visits, if that can be done by phone or video.
Can I maybe add there? I think the things are a bit different in the UK. So advice in the UK, if you feel ill, is to check the NHS website, and there's a sort of thing that you run through there with advice, and then it will tell you whether to ring the emergency 111 service. It's a different number in Scotland. So we don't encourage people to ring their GPs first. They run through that system. So I think it's obviously just a different system. I understand where this question comes from, because I know so many people with FND have such frequent negative experiences, particularly in emergency settings, well, any health settings, where they just feel they're not being taken seriously, or you've got FND, there's nothing wrong with you, you've got another symptom. I think, as Catherine says, these are not neurological symptoms that we're looking for here, really. And you can objectively measure some of them, at least. So I would hope people won't run into those problems, but I know why people would be concerned about that, because of negative experiences they've had.
Absolutely. Thank you. Another question is from a mother that her child had developed FND after getting a virus. In a situation like that, would that change anything, or are they maybe more likely than other FND patients who didn't develop symptoms this way, or at least think?
Good question. I think we know that there are many, the most common triggers for FND are physical illnesses, and viral infections are one of them. It could be injury, it could be another condition. So, I mean, there'll be lots of people developing FND for the first time after COVID-19, I bet, so that will happen. If you've already had a virally triggered FND, are you more likely to relapse from a viral illness? I don't think we have any data on that, but instinctively I would think maybe a bit, because your body kind of remembers the experience, even if you don't, your body does, and your brain does, and that could perhaps be slightly high at risk. And we've got to strike a balance here, because if you worry too much about that, you're actually activating some of the same abnormal pathways in the brain that actually can produce FND as well. So it's obviously no good telling people not to worry, because it's normal to worry, but it's just try and, if you take that too far, just even monitoring things too much could actually be a problem, because FND is often a state of somewhere in the brain there's a sort of red alert system which is overactive, and you're trying, when managing it, to try and keep a lid on that, which is really hard in these times, I think.
Absolutely, I agree. I mean, we all in the end, we can we can't give percentages. We just don't know, and it might be a good time to also switch over a bit from talking about the risk to talking things that we can do and we can actively do to help us, help ourselves, help others in dealing with some of the worrying and the anxiety, and also talk about whatever resources might be available. So I don't know if you want to talk a bit, Bridget, about some things that FND Hope is doing.
Yeah, that would be great. We've actually, as you both know, you've been great supporters over the last, 8 years. We have World FND Month coming up, and we always have tried to tailor everything to being online anyway, but as you know, both of you, I think, had events planned, and we've had to cancel those. We had them planned all over both countries and Australia as well. We are going to be doing some more peer-to-peer support groups on our virtual platform here. We'll be doing a drop by, so if anyone just kind of wants to stop in, here's the link. They can come on, and we're just going to talk, ask questions. I do want to mention that we won't have medical professionals on those, but there will be. You know, I think one thing that kind of a lot of patients have been in isolation for quite some time, and we really tried to talk about how this is maybe even an empowering opportunity. I know that seems really strange to look at it that way, but it's an opportunity for our members to help their friends and to help their family, and to kind of maybe feel like that maybe these people understand them a little bit better who didn't before. And so I think even having those conversations can be helpful for members. And, you know, by all means, we're going to encourage our members through the month to give tips on how they have actually beat isolation. Also, our move-a-thon, we're encouraging everyone to move at home, whether that's dancing around with your children for a few minutes, wheeling around, whatever you can do, just to get everybody active and to participate with their friends and family in that event as well. Are there any other ideas that either of you have?
I think that was very excellent advice, and I've actually seen on social media or Twitter some things shared along these lines. You know, many people that have FND, I mean, hopefully not, you know, everyone, but at least for periods, are actually very used to not being able to do what everyone else is doing, and, you know, just go out and so yeah, I agree with that in a way. You know, I'm going to share some personal information here, but my youngest child is severely disabled, and my husband was joking the other day and saying, well, we've been socially isolating for 4 years. We haven't actually taken a single family vacation in 4 years. So, you know, so for many patients in with FND, but also with other disabilities, this experience of not being able to go out and is not uncommon. And so I think we are also in a very fortunate time that we can connect very easily by internet like we're doing right now. So I think there's also, as you said, Bridget, there's a lot of opportunity here for us to be creative. And the same way as physicians and hopefully mental health professionals are going to be able to offer services online, we can connect in other ways and reach more people at the same time, right? If you do a in-person support meeting, maybe you get 20 people together. If you have a virtual meeting, you can potentially reach thousands of people. So again, I think there's lots of things that we can do to still stay connected.
We also have another tip from one of our members, Lori. She has said that her tip is to it's no longer what we can't do, but can, and not what we haven't got, but have. And that's how I every day try to cope. And so I think that's just a great way of other members, that peer-to-peer support. And we do have those going on in specific countries. Those will be ramped up as well throughout the next few weeks as we kind of see how long this lasts. A couple other questions. Someone has asked if the Parliament event in the UK has been canceled. Unfortunately, yes, that has had to be canceled, but we are not giving up. And a lot of the Parliament members have been, at least, there's been contact with them. Many of them received our newsletter that went out yesterday. Many of them read it. So we are still able to do some connecting with those people even during this time. A couple other questions that aren't specific to the coronavirus, if we could maybe even hit some of those. Someone is asking, they'd like to hear more about the brain mapping and biofeedback treatment for FND. Would either one of you, and I do also should mention, we're going to cut a hard stop probably here in about the next 5 or 10 minutes, because there is a program on the BBC Channel 2 for those in the UK that we want to make sure that we allow time for. So with that, does anyone
Brain mapping, yeah, brain mapping and biofeedback treatment. I mean, those are two separate things, I think. So there's a lot, I mean, Catherine's done some of the work on this. There's lots of studies now looking at, is there a change in the function of the brain in people with a functional neurological disorder? The answer is yes. Brains are not working the same as people who don't have those symptoms. They're also not, they also look different to people pretending to have the symptoms. So I think those kind of studies are difficult. I think we've got a long way to go before we really can make very conclusive findings from them. But people like David Perez, Mark Hallett's group, where Catherine was, are all, and Selma Abach and Tim Nicholson in London, lots of groups producing really interesting findings. And every time we get a new study, we learn a bit more about which networks of the brain, which areas of the brain are going wrong in this disorder, because clearly there is something going wrong in the brain. Where else could it be? Biofeedback treatment is in its infancy for this condition. Alberto Espe did a study, I don't think you're on that one, Catherine, but to do with tremor, just looking at getting people to...
I wasn't on that study, but that was recently published, and it was not really biofeedback. It was more coaching to entrainment coaching. So I would agree with you. Biofeedback itself is a bit in its infancy.
Yeah, I think I think it's interesting. I think this is about helping people sometimes just to see their own symptoms. So I think one of the things that happens in FND is it's quite hard to get a sense of what's actually happening with your body sometimes, and we notice a lot with in physiotherapy in particular, putting full-length mirrors in front of people is often quite a shock to people, particularly with functional dystonia, and that's actually a really powerful form of visual biofeedback, I would say, just helping people to gain an awareness of what's happening in their own body.
So we won't have too much time to go into all the research steps, so I'm not going to go there. I really want to make sure I get the message across. There are a lot of things you can do, even now, even without seeing a physical therapist in person. So what I've been recommending to my patients is really focus on the relaxation, mindfulness, meditation aspects. And actually, I've been recommending that to all my patients regarding of diagnosis, because like I'm saying this to all my patients, movement and emotional circuits in the brain are very closely connected. So again, regardless of the diagnosis, all patients I'm seeing with certain anxiety, fatigue, symptoms get worse. And there's lots of resources, and I know we shared some of those on the COVID-19 handout sheet already. So here in the US, we have certain apps like Headspace, Calm, and then one app is called 10% Happier, and they've come out with a specific coronavirus sanity guide. So for short meditations, information to just sort of help us all to, even in this very stressful time, to have a calm moment and reset our brains a little bit to keep the worry at bay. And I think it is actually quite helpful if you can incorporate that in your daily routine.
Great, thank you. I just want to remind everyone that document is on our website. It's also available as a download, but there's some links on there for members if that is helpful. We will also be having more of the online support groups, and we hope to see both of you back in April with a webinar. And we'll also have a lot of other people joining us for a lot of different webinars throughout the month. But the next webinar will be with Dr. Chrissy Burness, and she is part of the BBC 2 program that is on tonight in the UK, but she'll be with us for a webinar on the 24th at 6 p.m. UK time. Of course, anyone is welcome to join us for that webinar, but she will be joining us. So if you have questions after watching, write them down. And is there anything else that either one of you would like to?
Well, I'm just looking at a question here from Michelle Rolfe, Michelle, you've asked just to clarify, in the UK, those who have FND and conditions like CRPS do not come under the umbrella of patients who are increased risk of severe illness from coronavirus, like other chronic neurological conditions. That's correct. I do not think that FND should be put in the same bracket as chronic neurological conditions like MS or motor neuron disease. You don't see higher rates of pneumonia, chest infection. So that's the really big message I wanted to get across tonight.
Okay.
Maybe my parting word would be, we're really all in this together. This is a pretty unprecedented situation in our living memory. And, you know, many healthcare providers go through very difficult times currently, especially really those in the front lines. So again, we have to keep connecting and keep talking and helping each other out. And we're going to get through this.
Absolutely. Thank you so much. And I appreciate everyone who joined us online. We had a lot of people with us today. So hopefully we answered their questions and were able to be helpful. So thank you, and everyone wash your hands, stay safe. And I guess keep your food storage and toiletries all up as much as you can. Have them all ready to go in case we're quarantined.
But not too much.
But not too much.
Save some for everyone else. Yeah.
Let's say that. No hoarding, people. Let's try to
no hoarding in the US. Unfortunately, no hoarding of masks. The healthcare professionals need the masks. Okay.
Yeah.
All right. Thank you so much, Bridget. That was very helpful to do this on short notice.
Yeah.
Thank you.
Yeah.
Thank you. We appreciate both.
Bye, everyone.